How do you treat a common fracture on top of the foot? Well, that depends on what area. And the good news is that most of the patients come in, and patients who ask this question will have a stress fracture on top of the foot of one of these metatarsals. It's usually 2 through 4. 1 and 5 are less common because they have a range of motion and shock absorption entity to them. These lower ones down here are really linked into the midfoot and they take most of the stress. Like a crack in a windshield, it's not truly fractured, but it will take anywhere from 2 to 3 weeks with support and rest. The fastest way to heal it, of course, is a walking boot or completely staying off at 100% with crutches. The other fractures are the fifth metatarsal base, this one over here. This one's more serious because there's a tendon attached to it, and that one sometimes will be in excess of 2 to 3 months. And sometimes we can also have to put hardware in there or a screw or a plate to pull these two edges together. Same goes for these. If you have a brake pedal injury, car accident, falling downstairs, these can break and require pins or screws. Sometimes we can use natural products like the new bone pins or bone screws themselves. Just depends on the type of fracture. Sometimes it needs a plate and screws just to stabilize the metatarsal. But that's how you treat those fractures on top of the foot. Again, it depends on the severity, and of course the hardest part is staying off the foot or finding a way to stay off the foot. And again, left is better than right. I see that a lot in my clinic. I have to tell patients if it's the right foot, that really encumbers your driving, so it takes more planning in your life. If you'd like to see some of the surgeries, those are on my generic YouTube channel where it shows all the different surgeries and Ask Dr. Moore videos. That's Dr. Robert J. Moore III. And there you can also throw out a question or two, and I'll do my best to get to them.